And so we should have also now connected Dr. Pinzas.
We are here actually in Milano because we have the Jane meeting these 2 days that this meeting is organized coincidentally. So the organizers were very kind to provide us with the opportunity to say a few things remotely. So thank you very much for that. Professor Casali said almost everything. I am here with my colleague, Professor Katamis, who is a professor of pediatric oncology and represents the University of Athens. He represents more than 20 colleagues who are participating in Jane and then in Jane 2. I represent the National Hellenic Research Foundation from the Committee Authority. So the University of Athens is affiliated in TAITI. So we are very happy to participate in Jane and in the next phase of Jane 2. And just a few words, 2 or 3 minutes, in complementing, if you allow me to share my screen, just 3 slides to show you in a little detail the contribution of Greece in Jane. So the competent authorities, the National Hellenic Research Foundation, Professor Sarigiannis and myself, and 2 additional senior experts. So the National Kapodistrian University of Athens has a PI of Professor Katamis, who is with me now. The aim is collaboration at the European level and national level with Jane and OIS, and of course then how to collaborate with CRANE and CCI for EU, like the next session. We are going to discuss in more detail in the next session. And finally, to let the Ministry of Health bring integrated expected results and benefits to cancer patients and society. So in a little bit more detail, we are coordinating as NHRF by Dr. Pletsa, we're coordinating the dissemination part of Jane. Evaluation and sustainability, we are participating, we are taking part, but mostly the National Hellenic, the NKUA and NHRF are participating in an area of expertise on complex and poor prognosis cancer with more than 10 members. Also in NKUA participates in NOE in palliative care, and also NKUA participates in OE on survivorship. Also in personalized prevention, both organizations taking part, and Omic Technologies and HRF is taking part. Also NOE and High Tech, both organizations are taking an important part in different aspects of that. And finally, Professor Katamis can say a few things, not only for this, but also for other things for the last...
we're very happy as a National Kapodistrian University of Athens to participate in this, in Jane and in Jane 2. We have taken the lead in some of the tasks in different work packages. One of particular interest is the cancer in adolescent and young adults, which I think that's a very, it's an issue in Greece that we need to promote more, because we need to establish a better treatment for this, for the young adolescents patients and the young adults. We're here with Alexandros Spidras to discuss with you if you have any questions or any comments in regard to Jane.
Okay, thank you very much. Thank you, Dr. Pinzas, Dr. Katamis. And
we are here to discuss the green paper, as Professor Casali described in the video that he has sent before. Thank you very much.
I can speak in Greek.
Thank you.
Yeah.
Thank you. And we also hope that you're able to stay also for the next session. It is the last session of the day. And now I will give the floor, yes, to my colleague.
So, Deborah, dear participants, a long day, and so we go to the last session now, last but not least. After having heard and getting to know much better our four flagship projects, ECHO, CCI4EU, Jane, and Crane, we enter the roundtable of forging sustainable alliances, a path for the future. And we have the pleasure to invite Laura Motto from ECHO's project to be the moderator of the session. And we have also Ms. Vasiliki Karaouli, the national focal point for EU for Health. And then we can go alongside the previous speakers. So we kindly invite Professor Giovanni Apolone to join the stage, Dr. Tit Albrecht as well. We have virtually Dr. Sofia Xesfingi joining us. We invite Dr. Anastasia Balasopoulou, as well as Dr. Olga Balaura. And of course, we just heard and hope we retain Dr. Pinzas and Dr. Katamis. And of course, Anabela Isidro. So here we are, we'll kickstart. And Laura, if you allow me, we have a full hour dedicated and reserved. But as we have discussed, it's up to you. If it's going to be earlier, it's George, he's going to give the closing remarks after the session. Thank you very much.
Thank you very much. I'm very pleased and honored to host this, to moderate this panel. I thank you, the panelists, and I thank you, all of you that are still with us. It has been a very intense day, and we are still talking about synergies. And here we are talking about synergies at EU level. But I just want to remind you that synergies need to be sought also at national, regional level, and sometimes we also work a lot to create synergies inside each single organization, actually, because I work with the researchers, and sometimes it's also difficult to create synergies among different projects within one single organization. And I want to take directly an input from what Professor Casali said. And I want to ask to the coordinators of the initiatives that have been presented and ask if you see among CCI4EU, COS, and RAIN, and also Jane, if Professor Pinzas wants to reply, do you see more overlaps or more opportunities for collaboration? And collaboration on what? Which common challenges we have, and we can join our forces to overcome them? It's a ladies first. So, Dr. Isidro, please.
Thank you. I don't see overlaps. I see more possibilities for collaborate. We have now all these big networks, and we have to, it's also a huge landscape when you think about Europe and about the differences in our, not geographically only, but also about culture and about ways of living. And then the researchers and the medical doctors and all this that we want to create, it's of course a clear field for opportunity of collaborating. And here, HECUS, I think it may help all these stakeholders coming together, and we already are in one group so that we can better approach each other. It's true that in the first year we were very busy in trying to understand and to define the different models and, finding the definitions for CCIs, CCCs, and all of this. So I hope that now we are more in the position of starting real synergies with each other and take the best out of our work.
Please, Professor Albrecht.
Yes, I think within our discussions, and I think it pertains also to our, let's say, partner projects, we should be aware of the contents more than of terminology. So what we are creating is better healthcare, better cancer research, and better collaboration for higher quality of life of populations and patients. So, of course, there are processes, we talked about those, that need to be followed. There are standards, there are requirements, and so on in various fields. But regardless of that, we should not miss the objective and go for the form instead of actually improving the quality of cancer care, because we have differences within and across countries, and we have to keep that in mind. And many countries are, let's say, lamenting over the fact that they are lagging behind others. Yes, but we know that there are some clear opportunities, and I think we have to grasp those. And then, as Anabela already hinted, we now can position each other better on what specifically each of us has to do. So it's more about deepening the processes within our respective activities.
Thank you very much for the opportunity to share some reflections. I fully agree with Albert about the fact that we have to concentrate on the content, on the objective, and not to spend time, waste time in finding some nice definition of what we are talking about. Of course, there is overlapping between the project, and some kind of coordination we need some kind of coordination, but some kind of exchange and coordination is still present because most of us are involved in the different projects, so we have a lot of opportunity to share what we are doing, future activity, and so on. Some kind of more formal coordination is very welcome, at least in order to avoid some useless duplication of initiatives like surveys and so on. We have to share as soon as possible the preliminary results of our project in order to facilitate the future implementation. I have only a couple of recommendations according to my understanding of the different projects, because I have in a position, a good position, because I am a coordinator of one project. I am involved in the ECOS as a leader of the work package 2, and my institute is also coordinating Jane. I think that two things maybe could be discussed and implemented. Next year, most of this project will be end. Some of them will have a formal follow-up, and others will have already produced something. I think that a good meeting altogether to present what done and what is expected to be done should be organized, inviting also people from the national, local health authorities in order at least to present what we have done and what can be used in order to improve the quality. The second point is that there is a lot of variability in quality of care and in outcome to bad between countries. And some countries need more than others some kind of very urgent intervention. My recommendation is that we have to identify determinants of inequality that are actionable in the context of what we can do, and to focus on these countries before the other, because big countries have a lot of money, have a good quality, even if there is still variability also within France, Spain, Germany, and Italy. But I think that we have to focus on the people, and so the country that need something with more, it's more urgent to make an intervention. So a meeting inviting health authorities, and also we have to try to find the way to make intervention as soon as possible when is needed, where is needed. Thank you.
Just a quick reaction, because on the follow-up project on the EU network of CCCs, we are actually thinking of such an event. We have already proposed and talked with Jane 2, but also with CCI for EU and ECOS. We have many partners, and we have all member states now involved in that project, plus 4 associated countries, Iceland, Norway, Moldova, and Ukraine. So it means that it is really a gathering of a large number of different partners and authorities. We estimate that these events would probably be of the size between 500 and 1,000 people, and this would make it a nice opportunity to use a yearly event to bring together all the projects.
Thank you. Professor Piltas, are you still online? Do you want also to react and also maybe comment on you have the privileged position to be involved in, I guess, all the 3 initiatives or the 4 initiatives?
No, we are involved in Jane, but we are following also the crane because Professor Tit Albrecht has joined some of the meetings of Jane, and we are very happy for that. So I know how now I have heard what he proposed already, a very, very nice idea. Perhaps him and Professor Apolone, who is from this institute, scientific director, where we are now, and we are speaking for here. This shows how integrated are the groups already. And you are in Athens, and we are in Milano. So it's this is very representative for the interaction already going on. I think this is how I feel it after 2 years, almost 2 years in Jane, and another 4 years that are going to follow in Jane 2. So before saying something more, I would like my colleague Professor Katamis to say something, because he's a clinician and he may want to contribute in this way on the question how this collaboration of these activities and networks can help further for the cancer care.
Well, I have the experience by working both on ERN of Genturis, PETCAN, and EuroBloodNet, as well as the Jane. I have a little bit involvement on the crane, so I'm not very familiar with the crane. But what I can say is that these are very ambitious projects, and of course there is such a big discrepancies between the countries. And within the countries, there's a big discrepancies with the delivery of care in cancer patients. So I think that it's very important for the Ministry of Health to recognize this fact and try to see how both the ERN centers and the Jane network, as well as the Crane network, will be able to integrate in the healthcare system of the country. And this particular for Greece, which I think that the care is fairly fragmented. There are many institutions that have treat oncology patients, and we need in some way try to unify and make the care of the patient a little bit more, I will say, at the same level, at least try to have it at the same level throughout the institutions in Greece.
Thank you very much. And we are lucky today that we have the experience of 2 national contact points. So I ask Dr. Karaouli, who is national contact point for the EU for Health program, can you help us in creating better synergies among our initiatives and how?
Yes, I hope so. I hope so. So I had prepared a small presentation, but I don't know. I don't know if it is worth to to present it because I have heard so useful. I have presented. So I have prepared that for the beginning in Greek. But so I will say very fast some very introductory words about the EU for Health program, its targets and its priorities that are mainly for COVID-19 pandemic, and also the European plan for cancer plan. That the annual programs are in the site of HADEA, and also all the possibilities for subvention are very well and analytically presented there, and that are also synergies with many other programs like Horizon Europe or Digital Europe, etc. The Greek Ministry of Health participates in a large number of joint actions for the EU Health Program in order to comply with the main objectives of the EU for Health Program. One of them is well known to establish new networks of expertise on cancer and cancer conditions. And second one, about the implementation of cancer screening programs. The role of the national focal points for the EU Health Program, which I have for the Ministry of Health in Greece, is mainly to assist in health program implementation and dissemination, and also to give information on the impact of the health information program in our country especially. Greece has taken advantage of the opportunities of the program to strengthen the health system in terms of resilience, efficiency, and health promotions. But we had also some challenges regarding the dissemination and the engagement and the alignment of national and European priorities. But we think that enhanced support and guidance to member states from the European Union mainly could alleviate some of these challenges and enable more effective participation. And I would also like to add some thoughts from this discussion, that all we know about the additional value of the joint actions, but now I can see also the added value of the synergies of the different programs. And I think this first forum on cancer is a very good opportunity to to demonstrate these synergies and to work on it.
Thank you very much. And I also asked to Sofia Access-Fingi. She's national contact point for Horizon Europe, but she's also chief chair of the Enterprise Europe Network, the sector group health in Greece. And she's also participating as project manager of the Health Network of National Contact Points initiative. And we know that in our initiatives, we are trying to put together different type of stakeholders. So there are the researchers, there are the innovators, companies, both big and small and medium enterprises. So we need to put together citizens and patients and the policy makers. So how all the network of national contact points can support us?
That's a tough question, actually, because supposedly its network has its own most relevant stakeholders. Let's say that the national contact points are focusing more in researchers, academia, institutions, and so on. The Enterprise Europe network that you have mentioned also focuses in the private sector companies, SMEs, startups, and so on. So hopefully, all relative stakeholders, no matter if they are dedicated or focused only on cancer or in health in general, hopefully, according to my opinion, will be under the umbrella of the National Cancer Mission Hubs. The most important for me is that we finally get to know each other in the Greek region. It's been, although we are in a small country, for me, and I'm not lying, it has been really, I faced a lot of difficulties, for example, in reaching out high policy stakeholders within the health sector. So now that we are getting to know each other, we know whom to reach and what to reach him for. It's an actual opportunity to move ahead in real operationalized synergies and create higher impact for our stakeholders.
Thank you very much. And one of the biggest challenge that all the initiatives have is the fact that we are trying to create structures, and but one model doesn't fit for all the countries, because all countries have different health and care systems, different structures, different bodies and authorities involved. And we don't have to forget the important role of the regional authorities, the regional level. So how can you ensure that the regional authorities are always involved in the process of building the comprehensive cancer infrastructures, the network of comprehensive cancer cares, and the national cancer mission hubs?
Thank you very much for this question. I think that for my position and role in the system is really to the core of our work. So you have absolutely right that the systems have different structure. Some of them have stronger regional authorities. Some of them have weaker regional authorities and strong other parts. In our case, the regional authorities have a history of 24 years, so they are quite well established, and they have, especially after the COVID period, they have a very clear and strong role in the elaboration and the introduction of new policies. So in our case, this is, I think, a good period that the regional authorities can support the creation and to ensure that some of the organizations or the network of organizations can become CCCs and can guarantee the level of service that is expected and required on behalf of such a scheme, a CCC or a CCC net. So how the regional authorities can support this? They will create the business plan. They will support in terms of personnel, in terms of infrastructure, in terms of IT, design and implementation, in terms of procedures design. So it is very, and in terms of KPIs also. So it is very important. And in our case also, it is a very good coincidence, not coincidence, we try to create that, that we have two pilots, so the interpretation of the results of these two pilots can be a guide for the next phases in implementation of CCCs. Also, and I'm finishing with that, the regional authorities are have the authority to make or at least propose, to make the decision or at least propose which organizations, which of the organizations are eligible or more mature to run for CCCs in order to avoid that in each village somebody would like to become a CCC. No, the regional authority can also guarantee this part of the process. I think they will play an important role, and the modeling, the piloting will help us for the modeling of the next phase.
Thank you. You also mentioned a very important point. In all the initiatives, there is an assessment of the different, or the maturity models of the different structures that we are building. And all the initiatives are also developing capacity building initiatives to support those that have a maturity model, low level of maturity model. So I'm asking, what kind of capacity building activities are you organizing in your activities, and you think that is something on which we can work together, for example?
This is for me.
This is for everybody. If you have...
I think that the capacity building is a very important kind of intervention that has the objective to prepare the ground for future changes in the structure and functioning. And according to the preliminary evidence from the survey carried out by ECOS and CCI4U, of course, in the 27 plus affiliated countries in Europe, there are a lot of difference in terms of amount of money allocated to healthcare organization, priorities, and too bad epidemiology in terms of incidence prevalence and too bad outcomes. Capacity building is very important because it can prepare the change, but as we said several times today, we can prepare the setting by acting at individual, institutional, or systemic level, but some very important changes should be implemented according to the priority of each member states. This is the reason why some kind of future initiative in order to put together the results of these 4 projects and to present them to what is supposed to take this kind of initiatives is very important.
Yeah, I think that one of the challenges that actually we need to help member states with is the fact that EBCP is a top-down document. This is not very common in healthcare. And this means that, of course, member states will have to adapt some of their organizational solutions in order to accommodate the space. Of course, this is met sometimes with surprise or with not really great excitement. I know that in especially smaller member states, there was the opinion that CCCs are suitable only for big member states and the small member states should be left alone. But the EBCP is very clear. I mean, maybe to some of you it sounds like I'm quoting the Constitution or the Bible, but it is the key policy document, and it says clearly that they have to be established in every member state. Of course, we know there are no conditions for exactly every member state in the physical sense, but in logical sense, this is definitely so. I think there are several levels of supporting these transitions. One is the formal context, which is standards, requirements, and so on. The other one is developing training capacity within member states and within the networks themselves. I think there is a lot of opportunity for that. Some of those activities will also have to be outsourced very possibly. The fact is that Deborah already explained the mechanism of joint actions. Joint actions can include only public partners, so we cannot have private entities working as partners. They can be subcontracted, but a private entity cannot be a full-time partner, which means that that will be probably also partly subcontracted. And then, of course, there is a more longitudinal process where I think all of our projects are now also looking at the Commission to show a more long-term vision, how they want to develop these capacities and how they want to support. We definitely will have to work with the new Commission, with the new Parliament, in order to explain that this avalanche of projects that was launched cannot just be stopped or, let's say, ended. Well, they will end, of course, at some point, but there has to be a sustainable structure at both levels, at the member state level and at the European Union level or European Commission level.
Okay, so ECOS, it's not doing so much on capacity building, but we are ECOS is more a network and about networking, about helping to breaking the silos and network people connect. And what we do, we also base a lot our actions on knowledge exchange. So we exchange with each other, with what is already ongoing at the national level, both in terms of national cancer hubs like structures, or even in citizens engagement, what other countries are doing, what should we do, and what shall we write that gathers all this information together in order that it's a facilitator for others to use. And we are not so much top-down, we are more in a co-creation way. So learning with each other and trying to co-create. It doesn't mean that at the national level, then the national cancer mission hubs may be top-down. Probably in some countries they are more top-down, and other countries are not such a hierarchical way of working. So again, a lot of flexibility is needed, and we surely need to work with each other so that we take the best out of these projects. And it's true, we need to guarantee some sustainability and to make sense of all these efforts that we are now doing in all these years. And I think these big projects also have a word for the FP10. So in ECOS, we are trying to already do some position paper for the next framework program, and maybe we could all think of something together, a short message for the policy makers. And this could be, for example, a good synergy between these big projects about the EBCP and the cancer mission, or whatever we may think of, so that this doesn't fall in the next framework program.
Maybe just an addition to that, maybe, I don't know if you were able to be so precise in noticing when Deborah was showing this year's calls, also on Horizon. There is Jane actually decided to go for a CSA that would support the development of networks. And we are now also thinking of something similar because, of course, the Horizon projects are a little bit more flexible. They are open to different types of entities, and they could also provide the inclusion, which is now a frustration, for example, OECI, international organizations, and so on, patient organizations, which are now somehow, yes, they are welcome, but legally they cannot get the funding beyond tenders and very limited funds. So this mechanism could be, and we will also be looking at not only at DG Santé, but also at RTD.
Before closing,
yes,
there are questions. Please.
It's just to mention, we have a request from the audience for a question. Yes,
just speaking about the capacity, to my perception, I think that all the projects, at least speaking about Crane, there is a set, not or many sets of standards. So building capacity means to try to respond or to meet these standards. So and elevate the organizations as as higher as we can. So at the end of the road, at least a capacity could be built in order to respond to guarantee a certain level for all the European citizens. Some of them could be higher, but at least a certain level should be guaranteed in some way in this road.
Thank you. Hello, my name is Maria Zima. I'm a member of a board member of Hellenic Cancer Federation. And since we have all of you participating in these 4 joint actions, I wanted to ask, I understand that all these that are being done, building capacity, the capacity building, the networking, so forth, of course, we see the patient prosperity in this. But could you tell us how exactly the patients' associations are being involved in this? I mean, Professor Albrecht just said something about the legal issues of the associations, but are there any other details you could share with us from your experience of these 4 projects and the upcoming one? Because you already talked about the horizon. Thanks a lot.
Yes, traditionally, of course, in the previous joint actions, there was the involvement of the European organization. So now, conversely, the next project, the follow-up project to CRANE, will, of course, start with a number of pilots, which were mentioned today. Well, sometimes the word pilot is disputable because you do a pilot in 1 location or 3 locations to test for 100. Actually, we will be testing the country preparedness in probably around 15 countries. And the number of pilots will be diverse based on the interest of individual countries. Patient involvement. Yes, patient organizations were involved to a certain degree in both, I can speak for Crane and Jane, to a limited degree, but now we expect them to be much more involved, but at the national level, so that they would really assess how these pilots respond to their needs and what maybe doesn't work that well, that we believe should be done, but represents a challenge. I will say we try to improve access, but of course, if you centralize certain facilities like radiotherapy, this might be challenging if patients don't receive also financial support in order to reach the locations where radiotherapy is taking place. Of course, that's not for the EU to solve, but it is something that we need to explore because otherwise it might really affect access and patient satisfaction and probably even outcomes. And of course, this would be counterproductive. I'm sorry to be giving a negative example for something that should be positive. There are ways of overcoming such issues. We had in the previous joint action IPAC a specific example where there was the distributional approach to the delivery of radiotherapy in southwestern Poland, in one of the regions. And because the capital where the center is eccentric, so it's for some people it was up to 250 kilometers far away, which of course is significant for something that you take a few minutes a day for several weeks. So patients will definitely be involved, and we have already approached our national authorities, I mean competent authorities in the member states to think about the level and the modalities of their involvement.
So basically in ECOS, we have 2 patient organizations. and we have work dedicated to patients' organization. And in our models that we are designing, we are based on a pentahelix model where the civil society has this, let's say, a similar seat as the other, the health and the research and the industry. So they should be, our hope and our understanding is that in these National Cancer Mission hubs, they should have the same kind of power than the other players. So they should be in a co-creation of whatever is being either a policy consultation or something for the research topic, whatever is in discussion. We want to also transmit this idea that it's good to involve citizens at the start, we can just so that the research is better understood and that the innovations can be undertaken without prejudice or without sensationalism that sometimes blocks many of our actions.
May I add something? I understand that the involvement of the patients is expected to be in different levels. For example, the patients need, first of all, access in terms of time, in terms of access to innovation, and, to pharmaceutical, etc. So these things may be can better discussed with central level, for example, access to innovation or related to reimbursement. Also, the patients need to be satisfied. So this maybe needs a more direct access to the level of service. So in that cases, regulations or provision should be developed for participations in certain bodies, or even within the oncology clinics. I have visited Poland, and I saw the participation of the patients to be strong enough in the hospital level, in the CCC level. I can mention the tumor boards, I can mention a direct a facilitator, a direct personal facilitator, and other ideas. And of course, we can develop more. This is what I have seen until now, and I can think about. Thank you.
Also in CCI4U, we try to implement as much as possible the recommendation from the European Union to involve cities and the patient as a co-researcher and in the phase of co-implementation. But we tried, it was helpful. We have also some kind of bodies that meet regularly, for example, the sort of general assembly of all the stakeholders and so on. Of course, in other kind of project was easier to do it. For example, in the PI, one other European project that has the objective to produce a new quality of life instrument to be used in Europe in all the languages and so on. We will produce this new questionnaire, quality of life questionnaire by the end of this year. And in that project, of course, the role of citizen and patient in order to identify the most important domain items and so on was very relevant. I have also to add that also in the context of OICI, we have in this day renewing one of our 4 working groups. And there is a new working groups very active that is just about the patient empowerment and the patient engagement, because as already said, in some countries, for example, in Italy, it's not very common to have a representative of patient expert in the decisional body of our institutions. And in order to have it, I think that we have to do a lot of work in the future, at least in Italy, because any time that I had the opportunity to work with patient and patient expert, there was an improvement in our capability to identify problems and to find solutions.
Thank you very much. I see that we have some work to do. we have some future perspective because we already booked in our agenda for the meeting that UNET-CCC will organize with all the initiatives. We will work maybe on the common position paper towards FP10. And I think that we can even develop more by meeting more frequently. If there are no other questions, I would thank all the panelists today, and I will move forwards to the final remarks of the day. Thank you.